The morning had started out so deceptively perfect that it almost felt scripted. The light outside their apartment window landed across the floor in soft gold, the kind that makes even unpaid bills look poetic. Mark Consuelos, still half asleep and pretending to know what he was doing, made his usual attempt at brewing coffee. Kelly Ripa watched him with that familiar mixture of adoration and concern. Because no matter how many years they had been married, Mark still approached the coffee machine like it was a puzzle created by NASA. But that morning, in their small cocoon of jokes and mismatched slippers, everything felt easy. They teased each other about the strange comfort of routine, his terrible habit of overworking, her habit of reading headlines out loud as if auditioning for a satellite radio job. They tossed jokes around like popcorn. They laughed about their dog's bizarre obsession with stealing one of Mark's shoes every morning as if the dog were conducting scientific experiments on footwear. Neither of them had any idea that the day would take a sharp turn into a reality they could never have rehearsed. It started with a call, unexpected, neutral in tone, but it pulled Mark out of their peaceful morning, replacing their silly humor with an uneasy quiet he tried to ignore. The clinic had asked him to come back for additional tests. The phrase itself wasn't alarming. It was the tone. Professional, polite, but too still, too careful, like someone balancing a glass they didn't want to drop. He pushed away the feeling. He told Kelly he would be fine. He told himself the same thing. But the truth was, he felt a strange storm forming just behind his ribs. Hours later, he sat in a room painted the kind of beige that made even healthy people look worried. The specialist walked in with a folder held tight, the way people hold something that's heavier than paper should be. And in a calm, measured voice, the doctor explained that his condition, something they had been monitoring quietly, had progressed in ways that required urgent attention. The world didn't fall apart dramatically. It didn't shatter. It just dimmed, like someone slowly lowering the lights on a stage. Mark didn't think about fear first, or even himself. Strangely enough, his mind raced through unfinished tasks, picking up groceries, Lola's college appointments, the scripts he still needed to read. He even reached for a pen, thinking that if he wrote the doctor's words down, they would somehow feel less threatening. Kelly watched him with a stillness that broke her heart. She had spent a lifetime making audiences laugh, smoothing awkward moments, rescuing interviews gone wrong. But in that cold room, she couldn't fix anything with charm or quick wit. All she could do was reach for his hand. And when the specialist recommended immediate hospital care, for monitoring, for safety, for precaution, she felt her breath catch. Not because of panic, but because suddenly, nothing else in the world mattered except the man sitting beside her. The ride to the hospital felt unreal. The taxi smelled faintly of peppermint and old upholstery. Outside, the city continued as if nothing had changed. People rushing, horns honking, vendors shouting. But inside the car, there was only silence, heavy and intimate. Kelly threaded her fingers through Mark's, gripping him like she could anchor him to the world by sheer will alone. When the kids arrived at the hospital, each of them coped in their own beautifully chaotic way. Michael made dry jokes because humor was his favorite armor. Lola organized people and schedules like a tiny commanding officer. Her voice was firm but trembling at the edges. Their youngest brought a stack of silly books and insisted on reading to Mark in a heroic attempt to make things feel normal again. In the waiting area, families clung to hope like it was the last seat on a crowded train. Kelly watched them and saw her own reflection in their eyes, the fear, the love, the desperate desire for good news. When the medical team said Mark would be moved to a special care unit for closer observation, it wasn't because they expected the worst. It was because they believed monitoring him closely would ensure the best. Still, the words landed with the weight of 1,000 unspoken worries. News traveled fast, too fast. A single photograph of Kelly leaving the building, emotional and overwhelmed, spread across social media like wildfire. Comment sections filled with theories and dramatized headlines. People wrote their own versions of events without knowing the truth. without understanding that this was not a spectacle, but a family desperately trying to stay strong. Kelly, despite everything, maintained a calm dignity. She released one simple message asking for privacy, hoping it would be respected, but the world rarely grants peace when emotion sells so well. Inside the unit, the atmosphere was clinical yet strangely comforting. Machines hummed softly like mechanical lullabies. Nurses moved quietly, their presence steady and grounding. Mark lay in the bed, the monitors reflecting numbers that looked intimidating, but were explained with calm expertise. His face held both exhaustion and determination, like someone prepared to fight with every breath. Kelly stayed beside him, refusing to let fear take over. Whenever silence grew too heavy, she read random lines from books, gossip articles, even cereal boxes, anything to keep him entertained. Mark, in turn, supplied snarky one-liners that somehow made the medical staff chuckle. Even in the middle of uncertainty, they found pockets of laughter. One afternoon, a nurse gently guided Kelly to rest, noticing her hands shaking from exhaustion. But Kelly, fueled by devotion and worry, pushed herself until her body finally said no. Her vision blurred, her breath shortened, and she nearly fainted in the hospital cafeteria. A kind nurse caught her, helped her sit, and stayed with her until her world steadied again. But the next day's headlines reduced her exhaustion to a sensational collapse. She felt a wave of frustration. The world outside the hospital walls seemed eager to shape their story, even at the cost of compassion. Days blurred together. Soft footsteps in hallways, whispered night conversations, anxious family gatherings. Fans gathered outside with flowers, handwritten notes, candles, and prayers. Strangers united in hope, sending messages of love across continents. Amidst all the noise and chaos, the kindness was a much-needed light. Then came a small shift, subtle, almost unnoticeable, but real. Mark's numbers began to stabilize. His energy flickered back, brief but promising. One afternoon, he even joked about the hospital food with such dramatic flair that Kelly left so loudly the nurse peeked in to make sure everything was all right. Those tiny victories, one good scan, a steadier heartbeat, a half smile, became treasures. They collected them like Polaroids of hope. Kelly sat by his bed every night, whispering stories from their past, reminding him of the countless adventures they still plan to take, the trips, the anniversaries, the inside jokes only they understood. Mark squeezed her hand, reminding her he wasn't going anywhere without giving her 1,000 more memories. Their love, steady, stubborn, fiercely loyal, wrapped around the room like invisible armor. Slowly, carefully, day by day, things began to shift toward better. Not dramatically, not in one sweeping moment, but in small, determined steps. And with each breath, each quiet laugh, each shared memory, Kelly and Mark rebuilt their world, not as characters in a headline, but as two people who loved each other enough to endure whatever came next. Their story, their real story, wasn't about fear. It wasn't about crisis. It was about family, resilience, humor, and the kind of love that refuses to fade when life turns dark. And for everyone watching, everyone supporting, everyone hoping alongside them, this was a reminder. Love is not measured in the easy days. It is measured in the days when everything feels heavy, and two people still choose to carry each other anyway.